Hi guys, my name's Bailey. I'm going to be doing a newborn assessment today. So first we'd walk into the room, make sure the baby's wrapped up in all her blankets and make sure she's warm and doing okay. And we would only take her blanket off of the areas that we were doing the assessment on during the time. Just make sure she doesn't lose her temperature or she isn't in any distress or anything like that. First we'd start off with her vital signs. We'd start off with her heart rate. We'd listen for a full minute to her apical heart rate as so. Show you that. Typical apical heart rate is 110 to 160, and hers was 140. Next, we'd listen to her respirations for a full minute, make sure she's breathing okay and all that. Her respirations were 42, and normal is 30 to 60. Next, we'd do her temperature by using a thermometer in her axillary region, so armpit area. So we would put the thermometer right here in between her armpit, hold it down. Normal temperature is 36.5 to 37.5 degrees Celsius. Hers was 37. Next, we'd go into our weight and our lengths. So first, we'd put her in a scale, as so. Weigh her. Normal weight is 5 pounds 8 ounces to 8 pounds 13 ounces. She was 7 pounds 12 ounces. Next, we do her full length of her body from her head to her toe. Normal is 48 to 53 centimeters, and her length was 50 centimeters. Next, we do a head circumference, so a measurement around her whole head. Normal for that is 30 to 38 centimeters, or usually 5 centimeters less or greater than the chest circumference. So hers was 37 centimeters. Next, we do our chest circumference all around her, underneath the arms. Normal for that is again 5 centimeters less than the head circumference. So hers was 32 centimeters. Next, we'd go into posture. Make sure she wasn't flaccid or any of her arms or legs weren't flaccid. They were flexed. She was able to move them well, making sure she had good posture. And then we'd assess her cry next, make sure she didn't have a high pitched cry like she was in distress or if she was hungry, stuff like that. Making sure it was just kind of a normal baby cry, if that makes sense. And then next we'd go into observing the skin all over the body, all over the head, looking for any birthmarks, making sure her color was pink. And normal would be acrocyanosis too, so she might have some bluish coloration on her hands and her feet. So we'd look at that. We'd want to take those off and see if she had any acrocyanosis. We would also want to look for any abnormal marks, like any nevus flammeus, nevus Mongolian spots, any kind of milia that are the white patches on the face area. Any kind of like if there's vernix, we'd want to wipe that off as well. That's the whitish creamish stuff that we wipe off after birth. But if there is some, we'd want to wipe that off, and we'd look for any lanugo, the little fine hairs that they have after birth that will eventually go away. So anything that's abnormal, we'd want to look and make sure that there weren't any wounds or any kind of stuff like that, or any birthmarks, delivery marks, stuff like that, any bruising or petechiae and all that good stuff, and making sure her skin is warm, not moist, not cool, stuff like that. Next, we'd go into our full head to toe assessment. We'd observe her head. We'd want to take off her cap. And we want to look at her fontanelles. So we'd want to look at the anterior fontanelle. It should be shaped like a diamond, making sure there's nothing abnormal with it. If it's bulging or anything like that, it just want to be normal, just flat. And then the posterior fontanelle is going to be the bigger one. It's going to be like a triangle. We want to, again, see if it's bulging, see if it's any problems with it, any openings, stuff like that. And we'd also want to assess for any cephalahematomas, like the big kind of bulging, kind of protruding off the skin, or any caput secundum, something like that around those fontanelles and the suture lines that are just bulging out from the head. Next, we'd go into our ears, making sure those were intact, making sure those were looking good. There wasn't any problems with them, any marks or anything like that. In the face, we'd look for any, again, we'd look for any Epstein cysts, like the white kind of like patches on the eyes, or Malia, which are kind of like the reddish white small patches on her face. We'd make sure her nose was intact and she had patent airways, making sure she wasn't having any nasal flaring, which kind of is a sign of respiratory distress, making sure she didn't have any of those. Looking in the mouth, making sure there isn't any marks or anything like that. We'd kind of want to feel inside the top of the mouth for the hard and the soft palate, making sure there wasn't anything wrong with that. Also making sure on the lips there is no cleft palate, cleft lip. And at this time, you'd also want to do the sucking and the swallowing reflex. So you'd want to put your finger into her mouth, make sure she was sucking on that, and also making sure her swallowing reflex was intact as well. Next, we're going to go down to the neck and the clavicle area. I'm going to take this down a little bit. Want to make sure her trachea lines up with her is midline, making sure it's not like off to the side or anything like that. We'd want to make sure she has good range of motion with her head as well, with the neck being a big problem with that. We'd also want to look at the clavicles, making sure there are no breaks or any fractures from birth that could cause issues because of maybe she's a big birth or a big baby, stuff like that could cause fractures or deformities. Next, we'd want to go into our chest area, making sure the chest is symmetrical, making sure it has good shape when she's breathing. We'd want to listen also to her respiratory sounds, making sure those are clear, making sure that you can hear normal respiratory sounds and breath sounds. If there was a little cracking, that's normal to begin with potentially, because there's still all that fluid in her lungs that maybe she hasn't been able to get out yet. Next, we'd go to her abdomen. We'd want to listen to her bowel sounds. Each area of the bowel we'd want to listen to. Go around. Make sure there's bowel sounds in all 4 quadrants. There's no constipation or any obstructions or anything like that. And then we'd also want to feel the abdomen, making sure it's not distended, tender, making sure she's soft. We'd want to look here and here on both sides to make sure that she had even abdomen, even stomach, making sure there's good contour to it and all that good stuff. Next, we'd go to our extremities. We'd want to make sure that she's moving her arms and her legs equally, making sure there's no issues with posture or good range of motion, stuff like that. We'd want to make sure that there weren't any bruises, any wounds, any marks, any problems that could arise in the muscles, making sure there's 5 fingers on each and just how simple that is. Making sure she's capillary refill is good, less than 3 seconds on each side bilaterally as well. We'd also want to do pulses. We'd want to do the radial pulse, ulnar pulse on both sides like so. And we'd also want to do her brachial pulses, so in her kind of bicep area, so like so right there. You want to make sure that's equal bilaterally. It's normal's +2 out of 3 bilaterally, so that's good. Range of motion is also equal bilaterally as well. Next, we'd want to kind of move her onto her back, make sure she had a even spine, make sure there wasn't any openings or neural tube defects that potentially could have arose during birth or throughout gestation, making sure she has good even back, no kind of like deformities or anything of that nature as well. We want to bring her to her front, and we'd want to make sure for both male and female there was a different assessments to this. So for a female, you'd want to make sure their labia folds are there, and there's no like tears or any issues inside the labia or anything outside of the labia and stuff like that. For males, you would want to make sure the circumcision, if they did have a circumcision, was intact. Their foreskin was intact as well if they did not have a circumcision. Just making sure there's rugae folds on their scrotum. Making sure the testes have descended down and you can clearly see them in the tract. Next, we are going to test the newborn reflexes. First, we would start off with the Babinski reflex, where we would stroke from the infant's heel up to their toes, and their toes should fan out, so they're going to be like this, and when we fan our feel up top to the toes, they should go like that and fan out. Next, we would test the Barlow, or we would do the Barlow test, which tests for hip dysplasia, where you would put the infant's feet together at a 90-degree angle, and you'd put a little pressure on their legs, like so. And it would be positive if the hip dislocates or the bone comes out of the socket in the hip. That tests for hip dysplasia. Then you need to do a test called the Ortolani test, which would confirm the Barlow test. Next, we'd test the palmar and the plantar grasp reflexes. So for the plantar grasp, you'd put your finger in the infant's hand, and the infant should try and grab your finger as so, like this. If I was like this, and the infant should go like that. Next, we do the plantar grasp, which is the same concept, but it's with the toes. If you put your finger under the toes, the baby should curl the toes onto your finger. Next one is the Moro or startle reflex. This one, you're going to put your head underneath in the infant's head. You're going to put it up a little bit, then you're going to drop it suddenly, and the infant should startle and go like this, move their arms, their legs out, kind of like a flexed out position. And then after that, we do the rooting reflex, where we put our finger we touch our finger to one side of the infant's cheek, and she should move her head toward that side and try to suck. It helps with the breastfeeding with the baby and the feeding with the baby. And then finally, we would test our, actually we have two more, so we would test our sucking or our swallowing reflex next, where you'd put your finger into the infant's mouth and they should start and try to suck on your finger, and then also the swallowing reflex to see if they have a good swallow reflex. And then finally, we do our stepping reflex, where you hold the infant up and have their feet barely touch the ground or the table, and they should try and walk or start moving their feet and all that good stuff. And I also forgot that we have to do our femoral pulses. We do our femoral pulses on our baby, equal on both sides, and then we also test cap refill on our toes and our legs and make sure there's no wounds, bruises, or anything on those legs and all that good stuff. And that concludes the newborn assessment. Thank you very much.